The biomechanics of physical activity. The chapter objectives include describe what a biomechanics is and what it encompasses, explain how biomechanics is useful to you and in careers in kinesiology and related areas, address what biomechanists and related specialists do, explain how biomechanics emerged in the field of physical activity, and introduce biomechanical concepts and the processes by which biomechanists and professionals in physical activity and related fields answer questions of interest in professional settings. The goals of biomechanics of physical activity include to understand how basic laws of mechanical physics and engineering affect and shape the structure and function of the human body. Understand mechanics, a branch of physics that documents motion, kinematics, and the causes of motion, kinetics, and to apply this understanding to improve the outcomes of our movements and increase or maintain the safety and health of our tissues. Why use biomechanics of physical activity? Our structures help us to function, for example, to breathe, run, text, and eat. Conversely, our movement affects our structure. Forces are needed to accomplish any task with movement. They also help maintain health of our body structures. A force consists of a push or a pull on an object or body, and some forces that influence body structure and function include forces applied to us by another object, forces we apply to another object to manipulate its motion, and forces acting on a bone. All of these are exemplified in the following figures. The application of biomechanics is to improve movement techniques for sport performance, locomotion, and motor skill acquisition, to improve equipment, prevent injury, guide rehabilitation and treatment, and biomechanics of human movement must account for factors influencing movement that include sensations, other performers, environment, emotion, prior experience, cultural expectations, socioeconomic class, and anatomy. The two main themes of biomechanics for physical activity include function, or how we produce forces to generate, maintain, or slow down movement during physical activity, and structure, or how forces such as gravity affect our body tissues. Improving performance through understanding mechanical laws. The performance of any person can be improved in almost any situation that involves physical activity, for example, repetitive work tasks, activities of daily living, exercise, occupational or sport training, sport performance, music playing, dance, and even lying in bed. If we understand how living organisms can best exploit the mechanical laws that govern how motion is controlled, then we can intelligently select the best movement techniques for a given performer to use in completing a certain movement task. Biomechanics and kinesiology degree programs. Most kinesiology degree program specializations require at least one biomechanics course. In those courses, you will learn to apply the mechanical principles for manipulating movement as well as other principles that can affect tissue health, and to use practical methods and tools to answer human movement questions relating to assessing or improving performance effectiveness or tissue health, including injury prevention. Most biomechanical assessments and diagnoses made by kinesiology professionals involve qualitative judgments based on observation. Working with other subdisciplines. Anatomy, exercise physiology, and motor behavior are crucial to understanding how our body structures produce movement. A kinesiology professional recognizes that our movements are also affected by psychological, sociological, and cultural factors. What do biomechanists do? They are often researchers, clinical biomechanists, professional enhancement specialists, ergonomists or human factors engineers, forensic biomechanists, university professors, or certified orthotists or prosthetists. The history of biomechanics includes antecedents in the ancient world and the Renaissance, as well as biomechanics applications which began in the 1800s. The late 1890s through the early 1930s recognized efficiency movement by Taylor. Taylor also influenced the Russians perhaps first to use the term biomechanics, and Passy and Skarstrom were the ones who first used the term kinesiology in the late 1800s in the United States. In the 1920s through 1930s, Ruth Glasso of the University of Wisconsin did extensive film analysis and classifying of movement. In the 1960s, there were conferences, organizations, and graduate-level programs that included the kinesiology section. The 1970s experienced rapid expansion, the inclusion of sports medicine and dance kinesiology, and the late 20th centuries includes a continued expansion of university programs and organizations, a switch from the term kinesiology to biomechanics to more clearly identify this subdiscipline. Research methods for biomechanics include motion measurement devices, including cameras, motion detection technology, videos, sensors on sporting equipment, and even smartphones, and force measurement devices, including transducers, platforms, EMGs, as well as computer simulations. An overview of the knowledge in biomechanics. How external forces such as gravity, ground reaction forces, friction, fluid resistance act on performers. How internal forces act on performers. How biomechanical laws of nature shape our movements, such as the law of inertia, the law of action, reaction, torque, or movement, propulsive forces, fluid forces, and so on. Why do we move in certain ways and not others? And is there such a thing as a perfect movement technique? Balancing performance, effectiveness, and safety. Biomechanists, as well as other physical activity specialists, can apply the principles of mechanical laws to do the following: enhance performance, reduce injury, evaluate the effectiveness of a movement, and select the proper sporting tool, equipment, or occupational equipment.